Nearly half of Americans suffer from periodontal disease, and those numbers will continue to rise due to growth in the aging population and the increased retention of natural teeth. With these elevated periodontal disease statistics come an ever-growing number of systemic health issues that include various types of cancer, diabetes, heart disease, Alzheimer's, and more. So, why, despite our best efforts, do these periodontitis case numbers continue to climb? The answer lies within the complete and effective removal of destructive biofilm that is organized, difficult to manage, and initiates the inflammatory response affecting overall systemic health. Existing methods that rely strictly on scaling and root planing only offer temporary solutions. Bacterial re-colonization begins almost immediately following subgingival instrumentation and may return to pre-treatment levels within a single week. Current adjunct treatments are limited in effectiveness and have their own challenges. Biofilm removal through irrigation only removes the outside layer of the microbial community. Locally placed antibiotics require strict post-treatment protocols that patients must adhere to, and bacteria may become resistant to the antibiotics over time. Studies show us over and over if there isn't sufficient root debridement, including the breakdown of pocket biofilm, periodontal destruction will continue. Dental professionals spend a lot of time removing the hard deposits, but we all know the true enemy is the active biofilm. So, what can be done to tackle biofilm effectively that also helps the periodontal pocket with long-term healing? Introducing PerioDT with desiccation technology. PerioDT is a topical liquid or gel intended for use as an adjunctive topical agent of tooth and prosthetic surfaces during the performance of periodontal debridement procedures. It assists with the desiccation, detachment, and removal of dental plaque, calculus, and biofilm. PerioDT utilizes desiccation technology, DT, to rapidly dehydrate and coagulate biofilm on contact, making it easier to remove with instrumentation. This unique, minimally invasive solution provides a proven way to finally tackle the periodontitis crisis. Eliminates nearly all biofilm, removes and coagulates debris from the pocket, is not an antibiotic, has no special post-placement instructions, sets up the periodontal wound to heal, red color to show where it has been placed. You benefit from having greater confidence in debridement and therapeutic efforts, and your patients benefit from improvements in overall disease indicators, including pocket depth and bleeding, as well as a better overall experience. 99% decrease in red complex bacteria 2 weeks after scaling and root planing with adjunctive use. Decrease in periodontal pathogens after 1 application. Bacteria and inflammatory mediators undetectable after 2nd application. Significantly effective in the treatment of stage 3 periodontitis. It is hard to imagine my ability to effectively practice dentistry without PerioDT. This is such a go-to tool whenever I am faced with any periodontal pocket around a tooth or implant that is just impossible to keep clean with home care and maintenance. The results have been incredible. I have seen gum tissue that has been problematic and bloody at every visit for years, all of a sudden become pink and healthy once I've added PerioDT to the treatment regimen. Learn more about PerioDT at youngspecialties.com.